Welcome to another session of Understanding Human Anatomy. Today we're going to begin a discussion of the thorax, and in these first couple of videos we're going to talk about the thoracic wall and the intercostal spaces. Now, I've sketched a diagram of the rib cage. You can see the manubrium of the sternum, the body of the sternum, and the xiphoid process. I've sketched in ribs 1 through 10. Ribs 11 and 12 wouldn't really be seen in this view. They are short ribs that end posterior to where we're seeing the ends of ribs 9 and 10 here. And I've shown the costal cartilages drawn in here. The first thing I want to point out is that the joint between the first rib and the sternum, the first rib and the manubrium of the sternum, is a synchondrosis type of joint. That simply means that it is a cartilaginous joint. The costal cartilage fuses with the manubrium of the sternum. There's no space. So the joint between rib 1 and the manubrium is a cartilaginous joint, a synchondrosis. The joints between costal cartilages 2 through 7 and the sternum are all synovial. All synovial joints. So if I put the lines in here, there, so these are all synovial joints, meaning there is a space that's filled with synovial fluid between the costal cartilage and the sternum. And then the costal cartilages of ribs 8, 9, and 10 are all synchondrosial type of joints. The cartilage just fuses. So 10's cartilage fuses with 9, 9 fuses with 8, 8 fuses with 7. There is a thoracic inlet. And the thoracic inlet is at the superior end of the thoracic cage. So it's this space surrounded by the first rib, the sternum, and it would be T1 posteriorly. And we have a thoracic outlet at the inferior portion of the thoracic cage or the rib cage, and it's this area out here that's bounded by the lower rib, whatever it is. So I actually have sternum anteriorly, and then rib 7, rib 8, rib 9, rib 10, and when you wrap around posteriorly, you'd have rib 11 and 12. The space between ribs is called the intercostal space. And I'm just going to point to one of the intercostal spaces. Find this one right here. The intercostal space. The intercostal space is bridged over by muscle, the intercostal muscles. And the intercostal space represents one of the primitive embryonic segments. So each intercostal space is a segment. And we just number the intercostal spaces 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10 and 11 would be around the back. The intercostal space. Now, what I want to do next is take a look at the intercostal space. And to do that, I'm going to look at just a segment. We'll draw a box to represent the area we're looking at, like so. And in the next slide, we'll look at just the intercostal space. So we'll just have a couple of ribs and the intercostal space. Let's start by sketching in a couple of ribs. So I'll start with the cut end of a rib here, about to the edge. And then come back. And then we'll sketch in the rib immediately inferior to it. Same process. So here are two ribs. So at the intercostal space is this area in between the two ribs. As I said, it's bridged over by muscle, and there are 3 layers of muscle. And what I'm going to try and do is draw them in different colors, and I'm going to start with the one that's the most deep, because we can then build upon it. We'll start by sketching in the deepest of the 3 layers. And this is the innermost intercostal muscle. The deepest of the muscles we're going to be talking about. And let me fill that in. And the intercostal muscles, all 3 of them have fibers that run obliquely. So I'll sketch some fibers in. To show the direction of the fibers. but they neither run straight across or straight superiorly to anteriorly. They run at an angle. And this muscle is the innermost intercostal muscle. And I think you're getting the idea of the direction of the fibers. So this would be the innermost intercostal muscle. The deepest of the muscles, and like I've done in some other videos, I'm typing in the name of the muscle in the color I've used to denote it. The next muscle is the internal intercostal. And what I'm going to do with the internal intercostal muscle is sketch it in. I'm going to start about a third of the way across, like so, because it would, after all, overlie the innermost intercostal muscle. And I'm going to draw it as if we took a flap and detached the inferior part of the muscle and folded that part of the muscle up over the rib that lies superiorly, so that what I've done is cut a segment out. That way we can still see the innermost while I draw in the internal. And let me do some coloring here. Get this colored in, and you'd find it very hard to see the fibers of the innermost, so let me touch them up some, make them harder to see. And what we're going to find is that the internal intercostal has fibers that run the same direction as the fibers of the innermost intercostal. In other words, the fibers of these two muscles are parallel to one another. So I'll get some fibers in here. And of course, with the muscle flap that we've cut away from its attachment and reflected superiorly, the fibers would be a mirror image. And this layer now is the internal intercostal. The internal intercostal muscle. Now, the most superficial of this group of muscles is the external intercostal, and I'm going to move over a little bit more to the right of the diagram and sketch in the external intercostal muscle. And again, I'm going to draw it as if we've taken part of the muscle, cut it away, this time from its superior attachment, and reflected it inferiorly. I'm going to draw that in like that. In other words, for this, the external intercostal, we're reflecting inferiorly. And again, let me color in the insides. Let me touch this up. And then I'll start drawing in the fibers for the external intercostal. And the fibers for the external intercostal are perpendicular to the fibers of the internal and innermost intercostals. And again, since the flap is reflected downward, the fibers in the flap are going to be a mirror image of the fibers in the muscle that's in place. Its attachments are intact. Now, all three of these muscles attach to the rib that's superior and to the rib that's inferior, and bridges across that space. So this is the external intercostal muscle, and all three intercostal muscles are innervated by the intercostal nerve that's running in the intercostal space, and we'll get to that in the next video. So they're segmentally innervated. The external intercostal muscle raises the ribs when breathing. The internal intercostal muscle and innermost intercostal muscles tend to depress the ribs when you're exhaling. So the external intercostal for inhaling, the internal and innermost for exhaling. So these are the muscles of the intercostal space: the external intercostal, the internal intercostal, and the innermost intercostal. What we're going to find is that the external intercostal muscle stops somewhere along here, somewhere just about where the costal cartilage begins. And the remainder of that space, that layer, is filled by a membrane, the external intercostal membrane. The internal intercostal also stops being muscle, but it's posteriorly. So on the posterior aspect, you'll have an internal intercostal membrane in the layer that we would call the internal intercostal muscle. And it's important to remember that you can see the fibers, the collagen fibers, in the membrane, and the fibers of the external intercostal membrane run the same direction as the external intercostal muscle. The fibers of the internal intercostal membrane run the same direction as the internal intercostal muscle. The innermost intercostal is incomplete both anteriorly and posteriorly, so that there is a membrane for the innermost intercostal close to the attachment of the rib to the vertebra and close to the attachment of the costal cartilage to the sternum. In the next video, we'll take a closer look at what's going on in the intercostal space in addition to the muscles. Thank you for your attention.